Hello and welcome to Pisgah Health Today. My name is Angela Owen. It's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Lelia Duncan, who is the Executive Director for Big Brothers Big Sisters Western North Carolina. Welcome to our program today, Lelia.
Thank you so much for having me.
We are excited to talk with you. Lelia comes to us with over 30 years of experience in the nonprofit world. She is an outgoing, dynamic corporate nonprofit leader with a broad-based operational and sales management background. Great experience to help lead you as you lead that organization there. Why don't you start by telling us a little bit about Big Brothers Big Sisters Western North Carolina?
Well, it's just such a tremendous organization. It's been around for well over 100 years.
Wow.
And at the core of Big Brothers Big Sisters is one-on-one mentoring. And we know statistically from a bazillion studies and just from our own experience how successful one-on-one mentoring is. Because when you take the time to create the space to really reach a child, to be there for them, to be present, you do, as our mission says, ignite their potential. And there is absolutely nothing more gratifying than watching a child experience things that they would not normally have the opportunity to do so. And so I just love it. We have 3 different kinds of mentoring, actually. We have what we call community-based mentoring. So that's where, let's say you're a big sister, you would meet with your little sister for approximately 3 to 4 hours every 2 weeks. And it might be grocery shopping, it might be climbing a mountain. It might be going to a play, but you just really develop a rapport. And often our matches last for 15, 20 years. It's really incredible. We have school-based, site-based, where our mentors actually go into the schools. It's a little bit different with COVID now because we're doing it virtual, but you spend an hour, 30 minutes of that is working on school assignments, school readiness, and 30 minutes again is on just developing that rapport and being a good mentor. And then we do some group mentoring, depending on circumstances, if that works best or not. So we're kind of a full plate menu.
Well, it's a power-packed full plate menu, though, and I love what you're saying, Lelia, with the whole one-on-one, because to me, that gives that opportunity for that person to really reach in and help to affirm and bring about, I think you described it, ignite their potential. Like the power of someone that is saying to that young person, this is who I see you to be, and this is who you are, and pulling out the talent along the way. Well, Lelia, tell us, how did the grant that you guys received from Pisgah Health Foundation, how is that specifically going to help you serve these young people here in Western North Carolina?
Well, first of all, we're really grateful, and I just want to say thank you for granting us the opportunity that you have. With our Pisgah Health Foundation grant, it's funding a program we call Sports Buddies. And it really is about helping us recruit more guys, because we have lots of women volunteers, but not as many men as we'd like. And we have so many little boys standing in line just wanting to have that male figure. 85% of all of our kids come from single family households. And oftentimes the head of household is a female. It might be a grandmother, it might be a mom, it might be a foster mom. And so it's really so important to find these boys mentors, someone they can look up to, that they can just kind of model. And so the Sports Buddies program, who doesn't like to play sports? So it really hits on all these cylinders of being very active, being very strategic, doing something both the big and the little are going to enjoy and can enjoy for a lifetime. And it ties into also our focus on being healthy, being active, being involved, being engaged, because you don't have to be a pro football player to love football, right? So it's a great opportunity, and we're looking to expand our numbers of people we serve in the counties that the grant encompasses. So thank you again for that.
Well, it's exciting to hear, and especially with you meeting that need. Like you said, they're looking for this male figure. They're looking for that example and someone who is a man that's going to pour into them. Now, Lelia, with COVID-19, have you had to pivot that program in any way? That seems to be the big word of this year.
I
Pivot along
know.
the way.
I like to think of it as a different way. At first, I think, well, let me just back up. I came into this role in the middle of COVID. So there were weeks where I didn't even meet staff except through Zoom. So it's been a very interesting experience for me. And I would say instead of pivot, I think it's allowed us to be more creative, more
Mhm.
innovative, to be more thoughtful, to be more strategic, to really ask our bigs, those are our adult volunteers, how do you feel like you're connecting with your little? And it's been challenging because it's one thing to be in the car and talking to each other and watching each other's expressions. It's another thing to be on Zoom after people have Zoomed all day long.
Right.
So we've come up with lots of fun things they can do online. We were able to meet in driveways and in parks. And so for the most part, we've been able to keep those matches together. Our challenge, of course, as the schools have been, how do we allow our volunteers to go into the schools so that we're not adding another layer of work for the schools and that we're protecting our bigs as well as our littles. And so that's been really interesting, but we're getting there. And we lost a couple of matches this summer, but we're getting them back and we're excited about it.
When I hear you talk, I think immediately you're taking your game to the next level to kind of continue with that whole sports buddy
Yes,
analogy.
that's
Like
great.
it's not just let me pivot to survive. You're like, let's elevate what's happening here. And probably while there might be some of those changes that are limited to this season when we're facing a COVID-19, there are probably some changes that will be long lasting and impactful that are going to continue to really help you take the game to the next level. So congratulations and well done.
I really think so. And I think that that's very intuitive. You jumped on that because oftentimes, I think if you're playing sports, you get so focused on the game. But now that we're having to do it virtual, it's really helping those relationships to develop at a deeper level quicker. They would have gotten there, but there would have been a lot of gamesmen going on. So I am very excited about how it's turning out and what our results are going to be. And we're just grateful again for the opportunity you've given us.
Fantastic. I love it. Well, Lilia, before we wrap up today, what else would you like our viewers to know? How might we come alongside, get involved, and support Big Brothers, Big Sisters?
Well, we're in 17 counties in Western North Carolina. We have 10 branch offices. We are always looking for adults, women and men who really are committed and want to make a difference in a child's life. And likewise, if you're a pastor or you're a school counselor or you're a parent or you know of a child that could really benefit from having a mentor, call us. You can find us on the website. You can find us on the Facebook. We're real easy to get in touch with. And the last thing I just want to say is our job is not to replace the parent at all. We're there to support the parent and to bring more resources in. So every step of the way, the parents are involved in setting goals, deciding if an activity is correct or not, and even helping choose their big brother or big sister. So it truly is an encompassing program, and we're really excited about it. So call.
Fantastic, super engaging opportunity. Lily, on behalf of the Board of Directors at Pisgah Health Foundation, I want to just say thank you to you and to the others who are serving so faithfully and making such a big difference. And I imagine you're not just making a difference and impact in the littles, but the bigs are also rewarded in countless ways as they come alongside and really do help ignite the potential. So thank you again so very much for the work that you are doing and making such a difference for Western North Carolina. We really appreciate it.
Thank you.
We also want to thank Wildflower Media for their technical and creative support in bringing this program to you, along with thanking the Board of Directors and the staff at Pisgah Health Foundation and the Physicians Roundtable. We are so blessed and fortunate to have so many people working to improve the health, wellness, and lives of Western North Carolina residents. Until we see you on the next Pisgah Health Today, stay well, be well.